Good evening, everyone. We are here with yet another session. Today, we are here with Dr. Rashmi Jain. She is BNY's doctor. And today, she is going to talk about science of weight loss. She is a naturopathic physician working as a yoga consultant and a medical officer. And she is also a founder of Yoga Tevisa in Instagram. And it's an Instagram page where you can follow her for her activities, and she is having an expertise in healing metabolic disorders, stress related issues, and lifestyle modifications. So, with this small introduction, I would like to welcome you on our platform On Your Growth. Thank you so much to give your time with all of us.
Thank you, Dr. Bhavish. It is like a great pleasure being here, sharing my knowledge about weight loss. So before actually I start up with the proper theoretical or scientific basis of weight loss, I thought of taking this topic because it's very important nowadays. Being a naturopathy physician, yoga therapist, we come across a lot of people coming for weight loss with not a good amount of right knowledge. So it's very important to educate the client to know what to educate the patient to know what is weight loss, what can someone expect when we tell about weight loss. So let me share my screen. Just a second. Hope my screen is visible.
Yes.
Okay. So in this science of weight loss series, so I'm gonna talk firstly about what is weight. Then we'll slowly come to weight gain. What will happen when you gain weight? And the next is very important and very confusing topic, that is weight loss. Okay. So let's come to next topic, that is what is weight, right? Uh, I get a patient who will come to me and tell that, doctor, I want to lose weight. So does that mean the person want to lose their muscle mass, or want to lose their water, or want to lose their bone strength or fat? So to be very precise, it is very important to ask this question to ourselves. What do you want to lose? Whether you want to lose fat, water, muscle, or bone. It's obvious the answer is fat, because muscles, bones, and water are just strengthening structure of your body, and something that you want to lose up or you want to make your body slim enough is only fat. So from today, try not to tell it as a weight loss. Get that weight loss word into a fat loss. So let's see about how do we gain weight. What are the reasons? The very important reason at this generation is lack of physical activity, easy accessible to the junk food, or maybe no proper timing, or not getting good enough sleep, maybe because of the irregular sleep pattern, or maybe there is a lot of stress. Some medications, some of the medication also make you to gain some weight. And by the end, maybe from 30 to 40%, there may be a chances of family history. If your mom, dad, or your grandparents have this history, there is a chances that a person without any of the below mentioned, that no much irregularity with food activity, but still they can gain weight because of the family history. So next we can see how stress can cause you weight gain. So when a person is stressed, their body starts producing lot of cortisol. So cortisol is just a stress hormone that is produced in the body. So when this hormone is produced, body needs lot of more energy, because it thinks that body lacks energy, so it needs lot of energy in that. So it starts getting a lot of sugar cravings to compensate that energy need, or it will deplete the metabolism. So what is happening because of the excessive stress in the body, the digestion process is also hampered. So because there is a very common scenario what we come across in nowadays, that emotional eating. When you ask people, why do you eat so much of junk? They come up saying that I am stressed, I have workload, I have a deadline project. to which I need something to eat so that my brain works. It's just that emotional eating. There is nothing very strong theory basis that when you are stressed, you must eat pizza, then only you can come out of it. And the last one, there is a disturbed sleep. Sleep is a phase where your body is resting, rejuvenating, restoring the energy. When there is no proper sleep and there is a disturbance in the sleep pattern, that leads to weight. So coming to the very crucial part of weight management journey is metabolism. So metabolism is nothing but the process by which the body changes food and energy into energy, food and drink into energy. As simple as that, if we take an example, we eat a burger. So to convert this burger into energy, the process that's happening in your body is called as metabolism. Even when you're at rest, maybe when you're sleeping or sitting, your body also do some work, right? Especially breathing, digestion, there's a growing, there is a rejuvenation of cells. So for all this, you need some particular energy. So the body uses the energy at the rest. That is called as basal metabolic rate or basal metabolism. So normal metabolism is when you're doing certain work, maybe when you're eating food, when you're doing exercise. But basal metabolism is something when you are doing a more of resting position, the metabolism is happening. So let's see, when it comes to a one own BMR, that is basal metabolic rate, is very important for a person to know how active they are and to start up with their weight loss journey. So this is a small formula that BMR can be calculated, which has to be calculated when a patient comes to you or when you're looking for your own weight loss with your own diet that you're following. Try to calculate this in this way and you can go for it. Okay, so here what happens is there's a different BMR formula for women and men because our body composition is different. Our muscle mass, bone strength is different. So that is the reason there's a little bit of different numbers has been mentioned. So let's take an example of 30-year-old female with a height of 5.6 or 167 centimeter. Weight is 54.5 kg. So with this formula, I can make out that the basal metabolic rate or the metabolism at rest is 1339 calorie per day. So this will tell you how your body is working and how good your basal metabolic is. And next, we'll see, depending on that, what will be the actual calorie or the amount of calorie one has to burn to maintain the weight or has to reduce to lose the weight or something. So we have a formula. We know if I am I'm always a desk job. I take an example of engineers or maybe someone with a corporate field. We always sit in a desk and work with our laptop. So that is called as sedentary. So at that point of time, I can take up my BMR, multiply with 1.2. So we know how active we are. So depending on that, if we are lightly active, moderately active, very active or extra active, depending on this, we have to calculate. So it gives us the actual calories that we need in a day. For example, below I've mentioned after the calculation, it is 2075 calories per day. So this is the total calorie you should eat every day. You could eat every day if you want to maintain your weight. If, for example, in this example, I've taken a moderately active. So 2075 calorie is something that has to be taken every day to maintain the weight. What if you want to lose weight? If you want to lose weight, definitely we need to step down from there. So we need to calculate the calorie a little bit lower compared to the actual calorie that you have to eat. But if you want to gain weight, we can increase up to that. So this is a very simple self-using activity multiplier, which will help for yourself to understand what is necessary for you to lose weight or maintain weight or gain weight. This, okay, then we'll come to the role of starvation. So, just take an example. A patient comes and they already had lot of fasting. Especially, I will not say it as fasting because fasting has a very therapeutic basis. So let's say something as a crash diet. So they don't eat 1 day, 2 day. They are on only water or maybe liquids unevenly. So in fasting, we give it as a particular format or fashion, so that you have to follow that. But what happens in starvation? There is no proper procedure have followed. Just that the person is not eating food or cutting down their calories. Let's see how this impacts on weight gain. See, okay, what happens when you drastically cut down the food or the calories? So your body needs energy, right? So maybe in the form of when you are in the rest or maybe you are doing some work, body needs energy at all 24 hours if your body is working or is alive. So what happens when you start cutting down your calories drastically and all of a sudden without preparing your body starves for energy. So when this starvation happens, your body goes to the generator mode. Generator mode is very simple. Imagine you have a power cut at your home and you have to switch on generator or maybe inverter. So what we do at this point of time, we think we be more clever to understand what to use. We'll not use everything, right? We'll not use our refrigerator together, mixie, light, fan, all put together. We use our brain to use what is really necessary. In the same way, when it is in the generator mode, the body starts using its own muscle and starts losing the muscle. So this muscle loss happens. Definitely, I told you in the first slide that muscle is also a component of weight, a major component of weight. So definitely when you go to a generator mode, instead of fat loss, you're starting losing more weight. So to replace the muscle loss, the body starts putting up more and more fat accumulation, due to which your metabolism is hampered and you gain weight. So when you don't have muscles, automatically the conversion of the food to energy, the catalyst is being reduced, which leads to the reduction in the BMR, or then the food is not directly converted into energy, rather than most of the part of the food is converted into fat. This is all about starvation. So we should always take a proper guidance from any dietitian, any naturopathic physician. If you're looking for any sort of fat loss, then that is something has to be there. And then we'll come to something very important, that is weight gain and insulin resistance. So this is mostly seen in metabolic issues, especially PCOD. So let's see what happens there. So when you're taking more and more food or calories, the body will be in the healthier weight. But once you start taking more of food, the food has more of sugary content in it, and the body starts producing lot of insulin. But when you take those food in a right quantity, right timing, that's fine. But if you take something in a inappropriate or maybe in disrupted way, then you'll end up having insulin resistance, because body starts producing a lot of insulin, but the body is not utilizing that. So this is all about what we have learned so far is about weight gain, how the body gains the weight and what happens during the weight gains and everything. Now we'll learn how to lose the weight. It's a very tricky and very difficult part in every human body. So we'll learn how to lose the weight. So three mantra to lose weight: good exercise, right and nutritious diet, and very mindful eating, mindful being and mindful eating. Let's see step by step what happens. So what happens when you follow a right diet? So diet will be given to you at your height and weight or your medical condition. So when you start cutting your calories or reducing the calories with the right or adequate nutrition. So this is when the body starts putting up itself in a fat burning mode because it's already depositing some fat, right? So to get the energy, to get more energy to the body puts you in the fat burning mode, because of which your fat is split. There's a lipolysis in the body, which leads for the fat loss. This fat loss is kind of permanent fat loss that is happening because there is a fat reduction. This is not a water reduction or muscle reduction. Because of decreased fat and increased muscle mass, your BMR will increase. Definitely, because your metabolism is very high and you can maintain the whatever fat loss you've been there, that fat loss can be maintained very well. Okay, so that is the important factor we all have to note down is it is not that all diet can suit you. Your body is different, your digestion is different, your gut health is different. So it may not be the food that I take to lose my fat may not be suitable for you. So it's very important to analyze, get assist from a proper physician, then go for a good diet. So when you're coming to a weight loss, we always say, no, I want to take this supplements, or there is also a procedure now called as cool sculpting where they freeze your body fat or something like that. But these all are secondary. First, trust your body, see what you can do within your body, what changes you can do within your body. So maybe there is lifestyle changes that is necessary for your body, or maybe you have to change your sleep habits. A small changes or a small stepping stone towards the good lifestyle can make a huge difference in your body weight. Let's see what are the features what are the pointers that we have to put into our lifestyle so that we can maintain the weight or maybe we can reduce the weight. Okay, eating every 2 hours. So this what happens when if you have a habit of eating one bowl of rice at a time, instead of making it one huge bowl of rice, why can't we split into 2 hours, once in 2 hours? Because once if you eat a huge bowl of rice once, your sugar level spikes up. Because of high sugar levels, your body produces a lot of insulin, which leads to the weight gain or insulin resistance. If we want to see it in different way, every 2 hours of meal, so you start your day with any juice, and then you come up to any sort of fruits or any breakfast. So what happens every 2 hours if you keep feeding your body? So there is no spike in the graph. There won't be spike in the blood sugar levels, or there won't never be a dip also, right? Because in the starvation mode, the body sugar levels dip because you don't take right nutrition. Body doesn't get a good blood sugar level, so that is when it starts dipping off. So what happens, and because of which you will be having low sugar, there'll be insulin also, there may be chances of fainting off. So that is why every 2 hours, if you start feeding your body, so there won't be any up and down, they will be maintained very well. And because you are nourishing your body every 2 hours, your digestion will be very intact, and there won't be any gut related issues that will come up. Just we need to be careful of the right kind of food that we take, because that is very important. It's not that every 2 hours I can take some junk or chocolate. Right nutritious food or every 2 hours. Split your meal in the way that you can take it every 2 hours. And next is we have hormones. We have two important hormones responsible for your food intake or fillingness. Especially insulin is one of the additional hormone which we have discussed already. What is the use of it? Another two, what we have is leptin and ghrelin. So when you're super hungry, something that produces in your body is ghrelin. There's a hormone which makes you feel that you need something to eat, right? And when we feel full, imagine you go to a buffet and you're super full. At that point of moment, your body starts producing leptin hormone where it has to be maintained. So to keep your hunger in a right way and to make your body fill in a right direction or to balance your leptin and ghrelin hormone, you have to have a good sleep, good exercise, good physical activity, and then right food. So following this three rule of our body, because I believe that the body has to be followed in this way. So at this point of time, if you follow this three things, the hormones will be well balanced and you can see a lot of difference in the hunger, or maybe you may feel there is the right amount of food has been taken up. Next, let's go for exercise. So when it is weight loss, everybody suggests, right? Do half an hour of exercise, 45 minutes of exercise or something. But here, what is a major role of exercise? So when you do exercise, automatically, definitely you'll be losing or burning some good amount of calories. But are you aware that even post your exercise, post your yoga, for 3 hours, you'll be burning a good amount of calorie, or your basal metabolic rate will be super high at this point. So what you have to do here, when your BMR is super high, it's very important. Within 2 hours, anyways, post workout, you'll be having a food. So when you have your food on a right 2 hours of gap between your exercise and yoga, so this basal metabolic rate, which is already high, will help you to improve your digestion. So there will be more of conversion of food into energy rather than food into fat. But we also have, some of us have a bad habit after exercise coming back and jumping into bed. So what happens here? It is just like you switch on the gas, you keep the rice, and then you switch it off. There's no point, right? The rice will not boil also, because it's just that you have on it for 10 minutes. It doesn't mean that your rice is cooked. In the same way, when your body basal metabolic is high, you have to utilize. If you come back and sleep, there's no point, because once sleep is a resting position, resting phase, where your body starts lowering down everything, your heart rate, your breathing, and of course, addition to that, your basal metabolic rate also decreases. So that is why post your exercise, try to eat food after 2 hours so that your digestion is really, really good, your gut health is super good, and don't go to sleep or rest post your exercise. So in weight loss, we have two important phases, that is active and passive. So as the word even suggests, active phase is definitely a phase when we start losing the weight. So just imagine you have started your diet a month back. So post maybe first month you may take some time to get adjusted and all. Maybe you may not see much of fat loss, but yeah, there will be definitely an inch loss happening. But that is a phase is called as active phase. So you start losing it. Just imagine you have to lose 5 kg of weight. By second month, you'll be reaching that goal, or maybe in the middle of third month, you'll be reaching that goal. So at this point, what happens? You will start losing the weight, but the passive phase starts, because you have to lose 5 kg to reach your normal BMI. You have reached it. So here the active phase stops and the passive phase starts up. That is maintenance. So it is very easy to lose weight, because you can do all sort of diet exercise for certain periods. If you have good motivation for certain periods, you can lose weight. But to maintain that weight, it is very, very crucial. So having the motivation for a longer time is very important when it comes to weight loss. So maintenance phase includes your body nourishment with the food, exercise, and sleep. It is same. Whichever slide I tell, to have a good health, good lifestyle, you have to manage these things. Along with this additional problem of the current uh, youngsters or current generation is stress. So if you combine all four and try managing that, so that will be a best part to maintain your weight or to hold on the good health. So when you go to any of the physician, you will be having some expectation, right? When you're going for a weight loss, maybe you get a patient saying, I want to lose weight because my cousin's wedding is there, or I want to lose weight because I'm traveling abroad. I want to get fit into some clothes, so I want to lose weight. So these are a few examples. So I wanted to compare this to a Santa Claus. Just imagine all the small kids during Christmas. We all have an expectation that Santa Claus would get me this gift, that gift. So we ask wish for it, right? In the same way, just go to a physician and just say, I want to lose fat or I want to lose weight. Doesn't make much sense. And it is something that anybody can help you out. But if you want something very special to be handled from the physician, especially naturopathy yoga physician, then you have to consider a naturopathy yoga physician as a Santa Claus. So you have to ask something beyond what is actually required, especially beyond your weight loss. That is permanent fat loss or weight loss. Okay, you just don't want to lose weight only till your cousin's wedding and don't want to boomerang back post wedding. You need to sustain that. Or just in case we want to understand, if you want to lose weight just to travel abroad or fit into a clothes, once you're back, just imagine you boomerang back all the weight. So that should not be there. You should lose weight permanently, increase metabolism. So weight loss can be muscle loss as well, but in muscle loss, you'll be losing your metabolism. So you should always ask a physician, I need some diet or I need some help to lose my fat, increase my metabolism, and overall be healthy and just be active. So when you're in the diet, when you're in the phase of weight loss journey, always ask question to yourself, how am I feeling? Am I feeling active? Am I feeling very much energetic by the end of the day? Or maybe am I having the concentration to do my work like earlier? Because when you're lacking sugar or lacking energy in your body, automatically your body reduces the concentration. But when you're having a right kind of diet, this all problems will not be there. So always remember your physician as a Santa Claus who will be helping you out in the journey of weight loss. So ask all this wish with them so that you can attain that in a much, much better way. So how me or how a naturopathy physician can help? I was telling entire slides, right? That you have to go to a right person to lose weight, to maintain weight, to have a nutritious diet. So here, when you go to a naturopathy yoga physician, they'll help you to have a customized. That's very important because my body is different and your body is different. So you need to have a customized, nutritious diet plan. So definitely yoga will be there, which will help for physical and mental strengthening. Physically, asanas will help you to tone up your muscles, just stretch your body, and pranayama meditation helps you to relax your body, mind, breathing together. And along with this, a naturopathic physician always guides you from the base. So they will check what is the root cause. If you're gaining weight, they'll check what is the cause of it. There may be PCOD, there may be thyroid, there may be diabetes. We don't know. So to understand this, they'll check all your history. They'll treat that first. With the diet that they'll be giving, that diet helps you to manage the root cause. If you don't have any root cause, it's absolutely fine. They'll start digging up your lifestyle. Because if you don't have any issue or metabolic condition, there will be definitely some lifestyle issue or lifestyle changes in sleep, stress, and everything, which led to your weight gain. So they'll start digging up, they'll start questioning you about the lifestyle, so that they'll get some answer that, okay, your sleep is hampered, your stress is hampered, or maybe you're taking a lot of emotional things, something like this, which they help you with the counseling, good support, psychological support as well. So putting all together, starting from the day, like you start from your bed and you ended your bed. So something which have to correct from the base, so that your entire day will be energetic, active, and concentrated. So all put together, you will also lose weight, you'll be more energetic, you'll be healthy as well. So this is all about the some knowledge what I had about weight loss, or the actual journey of weight loss, and I have seen in my patients when I've prescribed weight loss, or the questions they come up to. So I think that's all, Dr. Bhavit. I think thank you so much for giving me the opportunity. Over to you.
So just wanted to know about few things from you. So
Please, yes.
first is like, what would be the new challenges? Because nowadays everyone is having that so many Instagram pages, YouTube channels, so many information is available in the market, in the Google. But how we as a naturopathy doctor differentiate ourselves to serve these kind of population in weight loss?
Okay, so to be like, if I want to be precise, I work in the platform where it is both weight loss, we have fitness, we have yoga, we have nutrition. So when it comes to a naturopathy doctor or a physician, what I have understood is we take it as a part of educating the client. So you have told there is an Instagram. Yeah, definitely Instagram is a good way to educate a person. But in Google, it depends how we filter out the answer, right? But when it comes to the physician, naturopathy physician, we deal with the checking with the cause of the disease. We educate them based on. So, for example, if a PCOD client comes to me, I cannot say, yes, I'll make you to lose weight within a month of 5 to 6 kg, because I should educate the client that your metabolism is low. We need to work on that. We need to work on the condition of what you have, so that we can lose weight. So educating and giving a clear cut picture what is their health concerns can help the client to overcome all these things, rather than just focusing on weight loss. I think that is a major difference between naturopathy physician and all other system of medicines, or maybe uh, degrees which helps a person to lose weight. But this works in a different way, where we are educating the client about their own medical condition and their impact on weight loss.
Thank you so much. And my next question would be like, how do you think that fasting plays a role in science of weight loss? Or is it just a different, there are two different ways to go for weight loss, or is it a part of the way you have explained?
So fasting is a part of weight loss, definitely, because it is the second part what I've told, no, that right food. Because during fasting, we don't directly ask the person to go for a liquids or solids or fruits. So there will be step by step, right? We start with the boiled, raw. So all these things will not hamper, or it won't lead to a starvation. So that is a very important point I want to highlight here. Many of them think that fasting is starvation. It is not, because fasting has been given in such a way that every 2 hours a person is given with some other food. And the second thing is, we are converting your gut, or we are protecting your gut with a good first boiled food, then slowly transferring ourselves to raw food, and then fruits and juices. So this transformation will never hamper the body, because that soothing or restorative effects of fruits, vegetables has been there in the body. But it has to be done for the shorter duration, not for a very long duration, and not for very much repetitive. Along with the fasting, you need to follow some other guidelines, as in sunbathing, getting up early in the morning, not having a lot of gadget usage, and evening not having much of late night works and all. So if you do all this together, then therapeutic fasting is the best. But fasting in, if it is not therapeutic, or if it is not a customized one, then it should be taken care. That is why we need to consult any physician or a particular right person to get into fasting and to break fasting. So the journey of fasting is very easy, but how to start, how to end plays a major role. And what are the additional features we have to follow during the fasting also important. So if all these are done in a right direction, then fasting will definitely help you to lose weight. And it comes in the science of weight loss only.
So my next question would be that how do you prevent the unwanted weight gain? Because sometimes our lifestyles also goes in that favor, but sometimes people who do not eat outside food, do a lot of exercise, still they would not be able to control their unwanted weight gain in spite of having once or twice in a week, like some kind of outside food. So how do we prevent that kind of weight gain?
Okay. So if that's what I told, no? If we don't have any metabolic disorders as such, or your BMR is good enough, but still you start gaining weight, there is some reason, right? There may be some reason, as in there may be a small sort of stress that you're going through. So understand that reason. If you want to eat junk, please go ahead, because restricting your brain will make your brain to eat more. Instead of that, if you really want to eat junk, take it as a one day, as a cheat day. That's what the modern nutrition say. It as cheat day. Take it as no problem. But remaining 6 days should be appropriate and stress free. So it's very easy for anybody to tell the no, you have to manage your stress, to control your stress, you have to control your anger. But what happens? It is not that easy for a person to do it. So at this condition, you have to educate the client, or give them a lot of ways where they can manage their stress, or they can control their stress. Because we have seen, right, how stress can lead to weight gain. This is one hidden reason for weight gain. When a patient comes to you, say, I don't have any problem. I don't eat a lot of junk. I just eat once in a while, but still I gain weight. So at this condition, for a woman, we have to check their menstrual cycle. Is there any irregularity? If that is not there, then we have to check their sleep or stress. These are the two crucial and hidden reason what I have come across in my 1 year of journey of dealing with patients of weight loss, that these two things patients don't actually open up. So we have to ask them, and we have to educate them what is the reason that they are gaining weight. So that if you educate the patient that your stress is the only cause of your weight, so they'll start working on it, they'll start thinking how to manage, so that they'll come out of that weight gain category. But definitely, cheat days should be there for every human being, because if your brain needs certain food, at least in a small limit, you have to give it. Just a portion control is important, and maybe we also have to listen to our tongue sometimes, or a palate sometimes. So just keep yourself happy, and have a right quantity of food. That's what I want to tell you.
What would be your final message to everyone who are going to watch this session?
Okay, so always don't directly go to numbers. So when you start your journey, you don't tell, I want to lose 10 kgs, 15 kgs. You should always have a goal. Losing weight should be the last pointer. Always have a goal. I want to have a healthy, happy life with a good lifestyle, good sleep, no much stress, good productive day. So if you keep your goals like this, and the last goal is to lose weight, then definitely you'll be losing weight in a very permanent way, or maybe slowly, but it will be very much better, and overall health will be good enough. But when we directly jump into the numbers, it's going to be demotivating for you sometimes. It may hamper your mindset because you're not losing weight. 1 month I've done so much of diet, I don't lose weight. So you directly go to a junk food. So always be patient because it's your body, it's your own body. Start loving it. Treat your body as a baby. So slowly give a progressive steps to weight loss. Rather than numbers, work on your body internally and externally.
Thank you so much, Dr. Rashmi, because we had a journey of understanding what is science of weight loss. And there are certain points which you have very clearly mentioned that there is no one factor which leads to the weight gain. There are multiple factors, and we have to deal with each factor at a certain period of time. And so, thank you so much to give that kind of approach and insight to all of us. And definitely, it is going to help many students who are pursuing BNYs and following by the doctors also to take some suggestions from your content. So thank you so much to come on our platform and have a very great sessions to all of us. Thank you so much.
Thank you so much, Doctor. It was really great. It is a huge pleasure coming up to your platform, having a session, and just sharing the thoughts. So I've been all the videos, like you are doing a great job. And thank you so much for taking up me as a one of the days as a speaker and giving me an opportunity. Thank you.
Thank you.